Hello everyone, welcome back to my channel and welcome to my new video. In this video, I'm gonna tell you what is A to E, what you're gonna check in A to E, what things you have to observe or check in airway, breathing, circulation, disability and exposure. So to know what is A to E, what things you're gonna check in A to E, stick this video till end to get this information, and please subscribe my YouTube channel if you have not subscribed yet, and like and share the video. So let's start with our A to E. As we know, in assessment station we do A to E assessment of the patient. We have to do A means airway, breathing, B breathing, C circulation, D disability and E exposure, observation of the patient. We have to check all the things in A to E assessment in assessment station. So what includes A? What includes in airway? What includes in breathing? What includes in circulation, disability and exposure? So this is what we're gonna discuss now. So first is A. A means airway. It means we check airway of the patient. So how we gonna check airway? Like before starting the A to E assessment, we have already done communication with the patient. We have asked his name and do the introduction. We have done the introduction part. So in this we have observed the patient, right? So we can say like, Johan, I'm observing you, like you are communicating well and breathing well. So I can confirm that your airway is clear and there is no visual obstructions. That's it. Only this you have to do in airway. In airway, you can just verbalize this single line. Like, Johan, I can see you're communicating well and breathing well. So I can confirm that your airway is clear and there is no visual obstructions. In normal, in actual, how we check airway, we have to ask the patient, can you open your mouth? Then we see if there is any visual obstruction or not. But in this, the patient is the only actor, that is not the real patient. So we can just verbalize like this. So this is airway. So what is next after the airway? After airway, there is B. B means breathing. So what we're gonna check in breathing? In breathing, we're gonna check firstly respiration rate of the patient. How we check respiration rate? We check respiration rate for 1 minute. So there would be a fob watch. They will give us fob watch to check respiration rate and heart rate of the patient. And for 1 minute, we will check respiration rate and also we will check rhythm and depth. So after checking the respiration rate, you have to verbalize what results you have got. If it is 22 beats per minute, you have to verbalize, okay, John, your respiration rate is 22 beats per minute, which is normal, and the strength and the depth and rhythm is also normal. So this is how you have to verbalize. If you have got 26 beats per minute, you have to tell 26 beats per minute. If you have got 19 beats per minute, you have to tell 19 beats per minute. You have to tell the actual result what you have observed. If the rhythm or depth is irregular or not normal, you have to verbalize that. If it is normal, you have to verbalize it is normal. So after checking the respiration rate, then you will tell that you can say that, okay, Johan, while checking your respiration rate, I also observed for any respiratory noises, and I can see that there is no rattle, wheezing and stridor noises. I haven't observed any such noises. And if you have observed, you have to tell, like, I can see that you are having wheezing noises. And then you will ask, do you have any cough? If whatever he is saying, according to that, you will give answer. If he is saying yes, okay, I will escalate to the doctor, and if I will check the prescription, if there will be medicine, I will give that to you. And if he is saying no, that's it. So after checking this, the next one thing what you're gonna observe is any respiratory distress. Then you will verbalize, okay, Johan, I also observed for any respiratory distress, and I can see you are not using any accessory respiratory muscles, and there is no any sweating, cyanosis and cease of breathing. So if you have observed something, you have to tell, yeah, you are having this. And if everything is normal, you have to say like I don't see or I haven't observed anything like this. You have to verbalize each and everything, cyanosis, squeeze of breathing, sweating. You have to verbalize each and everything so that the assessor can see that you are verbalizing everything, you are checking, you are really observing everything. So this is how you can check breathing. And there is one more thing, you will check oxygen saturation level with the oximeter. With the oximeter, you will check oxygen saturation level of the patient. So next thing what we check in breathing is unequal air entry. So normally how we check unequal air entry, we place our hands on patient's chest and see if there is any unequal air entry. So what we're gonna do, we will ask the patient, okay John, can I place my hands on your chest to check if there is any unequal air entry? Normally he will say no, because he is not the patient, real patient, he is an actor. But we have to verbalize this thing like, can I place my hands, so that the assessor can see you know how to really check unequal air entry. He should know this because this is in the marking criteria. So when he will say no, what you gonna say, okay that's fine, and I can see there is no any unequal air entry, you can breathing normally. So this is how we check breathing, and these are the things that includes in breathing. So after breathing, the next is C. C means circulation. What things we gonna check in circulation? The first is heart rate, and again we check heart rate for 1 minute. For that we will have stopwatch, and with the help of that we will check heart rate, rhythm and strength. And after that we will verbalize, okay Johan, your heart rate is 72 beats per minute, which is normal, and the strength and rhythm is also normal. Whatever reading or observation you have got, you have to verbalize the same and the same result. Then after we check blood pressure. How we check blood pressure? Normally with the blood pressure machine will be there, and you have to check with the help of that. You have to ask if the patient is having any arm preference, then you have to check the site if there is any skin infection or lesion, or if he is having any surgery on that arm. Because if he is having any surgery on that arm, you can't check blood pressure on that arm. You have to alternate the site. And if there is any cannula or fistula on that arm, you have to check these things. And then you will apply the cuff, BP cuff, and you have to apply the BP cuff in a good way, like which is the correct way. According to the antecubital fossa, you have to apply it. So then after you will check the blood pressure and tell the reading like, okay John, your reading is this, and if it is normal, it is normal, not normal, not normal. This is how you have to verbalize. Then after checking the blood pressure, you have to check capillary refill. How we check capillary refill? You have to ask if the patient is having any hand preference. Then if he's saying, yeah, I want to go with this hand, okay, that's fine. Then you will check if there is the site, if there is any infection or anything, if there is any false nails, or if there is any nail paint. Okay, then after, okay, so I'm happy to proceed. Then, okay John, I'm going to press your nail bud for a few seconds. Can I proceed? He will say yes. Okay, then, okay, 1, 2, 3, 4, 5. Okay, I can see the capillary refill is less than 2 seconds, which is normal. And I can see simultaneously you can check. I can see there is no pallor, because there is no any whiteness or paleness of the skin. So that is pallor. So you have checked the pallor also, you have checked the capillary refill. What left? Perfusion. That you can check with the oxygen saturation level also, or you can see, yeah, I can see it is also adequately perfused, because the circulation is normal. Only you will get normal saturation level if blood vessels, if the blood is circulating well in the blood vessels. This is how you will check circulation. So next is D. D means disability. What things we gonna check in disability? Firstly, we have to check the conscious level of the patient. So how we check? We will ask few questions like, do you know where are you now? Do you know who I am? Do you know what date or year is now? Today, what date is today? So this is how you will ask the questions, and according to his answer you will verbalize, my patient is alert, my patient is confused, or whatever the observation, whatever the answers patient is giving, according to that you have to verbalize. So then after, you have to check, you have to confirm the pain. Already we have asked about the pain in the introduction part, but we have to confirm it in disability also. We can just quickly confirm with the one question, are you still having the same pain? If he will say yes or no. Then after, you will check urinary output. In this, you can only ask one question. Okay, John, how is your urinary output? Is there any frequency, urgency, or burning sensation while urinating? He will tell you how is urinary output. You have to like tell him, you have to ask him like, is there any urgency, frequency, or burning sensation? You have to explain him these things. So this is how you will ask about the urinary output. Then after, you will ask about the blood glucose. In this, you're not gonna check blood glucose level. You will just ask, okay, have you ever checked your blood glucose level? He will say yes or no. If he's saying yes, okay, do you remember your recent reading or observation? If he's saying yes, he will say no. Normally he will say no, but if he's saying yes, okay, he will tell you the reading. If you're saying no, okay, that's fine, John, I will check with your records. That's it. You are not gonna really check the blood glucose level. You will just ask the recent reading. If he knows, and if he don't know, you will verbalize, okay, that's fine, I will check with your records. Then after, there is E. After the disability, there is E. E means exposure. So what things you gonna check in exposure? Firstly, you will check temperature. There would be a machine to check temperature, sensory machine, that is, you will check with that. And yeah, you have to verbalize, okay, your temperature is this, which is normal, and if not normal, you have to verbalize, which is not, this is not normal. Then after, you will check, you will ask question about, do you have any bleeds, rashes, or injuries on or bruises on your skin? He will tell you yes or no. Then after, you will check about the medical history. So in this, you will only ask single question, like, I can see you are having hypertension and diabetes mellitus. Is there any medical history or having you are not aware of? He will tell you yes or no, if he's having or not. Okay, so you just need to ask one question. You will have patient history form. In that, there would be written what patient's medical history is. You will just ask a question. Okay, I can see you are having this. Is there any other we are not aware of? He will tell you yes or no. That's it. This is A to E assessment. After doing this, you will just tell the patient, okay, I have done with your A to E assessment. Now I'm going to do the documentation. Are you comfortable? Do you have any concern? Okay, if you need anything, just press the call bell. I will come back to help you. That's it. Then you leave the patient, do the documentation, and then after, you will come back and tell the results, and then you will do the holistic assessment. So this is all the things you have to observe or check in A to E assessments. So this is how you're gonna do A to E assessment. So please subscribe my YouTube channel and like and share the videos to watch more videos about planning, implementation, and all the stations. Thank you so much. Bye bye.